prostate health and urinary function impairment. Men over 60, listen carefully, because no one else is going to say this. If you've stopped masturbating as you've gotten older, your prostate may already be suffering, and you don't even know it. This isn't a joke. It's not taboo. It's biology. And the cost of ignoring it could be painful, dangerous, and in some cases, even life-threatening. Your prostate isn't just some passive gland. It's active. It produces fluid. It contracts during orgasm. It helps regulate both your sexual and urinary functions. But here's what most men don't realize. When you stop ejaculating regularly, even through masturbation, prostate fluid doesn't just disappear. It builds up, it stagnates, and that creates serious problems over time. That stagnation becomes the perfect setup for inflammation and swelling. You might start waking up multiple times during the night just to urinate. Your urine stream may weaken. You feel a constant pressure or fullness that doesn't go away. These aren't just annoying symptoms. They're early signs of a bigger issue, benign prostatic hyperplasia, or BPH. This condition affects nearly half of all men over 60, and if left unchecked, it can lead to chronic urinary retention, bladder infections, the eventual need for a catheter, or even surgery. One of my patients, a healthy 72-year-old, thought he didn't need that part of life anymore. But after months of nighttime trips to the bathroom, he ended up needing surgery to relieve the pressure. Here's what the research shows. Men who ejaculate 21 times or more per month are significantly less likely to develop prostate cancer than men who don't. That's because regular ejaculation helps flush the prostate, clear out old fluid, and reduce inflammation. This isn't about indulgence or fantasy, it's about function. It's about using your biology to support your long-term health. So, if you've stopped masturbating because you thought it wasn't necessary anymore, understand that you're not just skipping a habit. You may be risking your comfort, your bladder control, and even your independence. This is your body sending a signal. Listen to it, take action, and remember, caring for your sexual health is still a vital part of caring for your whole self. 2. Distractions and cognitive fog. You walk into a room and forget why you're there. You start a sentence and lose it halfway through. You feel like your mind isn't as sharp as it used to be, but is that just aging? What if I told you the real reason might be something you're not doing anymore? Most people think memory loss and brain fog are just part of getting older. But there's a powerful, overlooked connection between your brain health and your sexual activity, especially solo activity. When you stop masturbating regularly, you're not just giving up pleasure. You're cutting off your brain's natural supply of neurochemicals that protect focus, memory, and motivation. Here's what happens during self-pleasure. Your brain releases a rush of dopamine, serotonin, and oxytocin. These aren't just feel-good chemicals. They're critical to your mental clarity. They help you stay focused, process information, and feel emotionally grounded. They improve blood flow to your brain and reduce levels of cortisol, the stress hormone that actually damages brain cells when it sticks around too long. But when you stop masturbating, especially over long periods, those neurochemical boosts disappear. And your brain starts to feel the difference, slowly at first, then more noticeably. You forget names, you lose track of conversations, you feel mentally sluggish, and you start to wonder, is something wrong with me? This slow decline can be subtle, but it's real. Patients often describe it the same way. I don't feel like myself anymore. I used to be so sharp. It's like my thoughts are swimming in mud. What they don't realize is that their brain is running low on the very chemicals that keep it alert and balanced because they've shut down one of the main sources, self-stimulation. For men, there's an added effect, testosterone. When sexual activity drops to zero, testosterone levels can decline faster. That hormone isn't just about libido. It's about drive, decisiveness, and memory. Without it, you don't just feel tired, you feel lost. So no, it's not always just getting older. Sometimes your brain is starved of the signals and support it needs, and all because you stopped something that once felt private or unnecessary. But the truth is, reconnecting with that part of yourself could bring back more than just pleasure. It could bring back your clarity, your focus, your spark. Don't ignore what your brain is quietly missing. Sometimes the path to a sharper mind starts with the most personal act of self-care. 3. Depression and emotional numbness. You're not sad. You're not angry. You just feel nothing. Not joy, not excitement, just flat. And you wonder, is this what aging is supposed to feel like? What if I told you the emotional emptiness you're feeling might not be emotional at all, but biological? Let's be real. Most people don't talk about this. That creeping sense of numbness, the lack of interest in things you once loved, the quiet thought, maybe I've just grown out of feeling. But here's the truth. Your emotional state is deeply tied to your body's chemistry. And when you remove one of the most natural emotional release valves, masturbation, you may be cutting off your body's ability to feel at all. Every time you climax, your brain floods with powerful mood-regulating chemicals, oxytocin, endorphins, dopamine. These aren't just feel-good sparks. They're your body's built-in stress relief system. They ease anxiety, they lift your mood, they help you sleep, reset, and even feel emotionally connected to life. But when you stop stimulating your body, especially in moments when stress, loneliness, or grief are already present, something begins to shut down inside you. Slowly, quietly, almost invisibly. You may stop laughing as much, stop picking up the phone, lose interest in conversations, hobbies, even food. And here's the cruel twist. You may not even realize why it's happening. Many older adults chalk this up to just getting older. But what's often happening is emotional atrophy, caused by the loss of healthy physical intimacy, even with yourself. When you stop giving your body permission to feel, your brain starts to believe that emotions aren't needed anymore, and over time, they fade. Depression in older adults isn't always about sadness. Sometimes it looks like fatigue, or irritability, or simply not caring anymore. But I've seen it change. I've had patients who said they felt alive again, just from reconnecting with their body through regular self-touch. Not for fantasy, for wellness. So if you felt numb, disconnected, like a shadow of yourself, don't ignore that feeling. It might not be emotional weakness. It might be chemical silence. And the first step toward feeling like you again might not be therapy or pills. It might be rediscovering the part of your body that still knows how to feel. You are still here. You are still human. And you still deserve to feel everything life has to offer, starting with yourself. 4. Sleep disorders. You're lying in bed, eyes wide open. It's 2 a.m. again. No noise, no reason, just your body refusing to rest. You try breathing deeper, adjusting the pillows, counting anything, but nothing works. What if the real reason you can't sleep is because of what your body's not doing anymore? Most people think bad sleep comes from stress, caffeine, or age. But there's another cause, one almost no one talks about. When you stop masturbating regularly, you cut off your brain's access to natural sleep triggers. That moment of climax doesn't just feel good. It actually prepares your body to rest. It triggers the release of oxytocin, prolactin, and endorphins, your brain's way of saying, it's time to relax, you're safe, you can let go now. Without those chemical signals, your nervous system stays on edge. Cortisol, the hormone behind alertness and stress, stays high. Your heart rate doesn't slow down, your breathing stays shallow, and your brain just won't quiet itself. One man told me, I fall asleep fine, but I always wake up around 2 or 3, like someone flipped a switch. We ran every test. Labs were clean, no sleep apnea, no red flags. But when I asked about his sex life, he looked away and said, that part of me is over. But what he didn't realize, what most people don't, is that the part he gave up may have been the very thing that once helped him fall into deep, healing sleep. When you sleep poorly for weeks or months, it's not just annoying,
it becomes dangerous. Chronic sleep loss raises your risk for memory loss, immune dysfunction, heart disease, depression, and even loss of physical balance. I've seen patients who used to be sharp, energetic, and active slowly wear down, not from illness, but from sheer exhaustion. Some start depending on sleeping pills, others just give up and accept the fog. But the body remembers what it needs, and sometimes what it needs is that natural chemical signal that comes right after release. Not from a pill, not from a meditation app, from you. So ask yourself, when was the last time your body fully relaxed? Not halfway, not just lying still, but truly, deeply let go. The answer might not be a new mattress. It might not be melatonin. It might just be reconnecting with the rhythm your body was designed for. Because sometimes the difference between 4 hours of tossing and 8 hours of healing comes down to a single, personal act your body still remembers, if you let it.
5. Weakened pelvic floor muscles and blood circulation. You start leaking a little when you cough. You feel pressure in your hips when you stand too long. Or worse, you're planning your day around bathroom access. Sound familiar? You might think it's just aging, but the real cause might be something far simpler and far more fixable than you think. Your pelvic floor is the foundation of your lower body. It's a group of muscles that support your bladder, bowels, and sexual organs. It controls everything from urination to core stability to intimacy. But like any muscle, if you stop using it, it gets weak. And one of the easiest, most natural ways to use those muscles is regular sexual stimulation. That's right. Masturbation isn't just about pleasure, it's a workout for your pelvic floor. During arousal and orgasm, the pelvic floor contracts rhythmically. This movement keeps blood flowing, nerves firing, and muscles engaged. But when you stop masturbating, those muscles go dormant. Blood flow slows. Tissue becomes less elastic. Nerve signals weaken. And what happens next? You start noticing dribbling after urination, leaking when sneezing or laughing, discomfort in your hips or lower back, loss of sexual function or sensation. It doesn't hit all at once, it creeps in. And over time, your body begins to lose control in ways that feel embarrassing, limiting, and even frightening. I once treated a retired firefighter in his 70s, strong, proud, used to handling emergencies. He came in saying, "I feel like the base of my body is giving out." He had mild incontinence, couldn't stand comfortably for more than 10 minutes, and had completely stepped away from his sex life, assuming it just didn't matter anymore. But what he didn't realize was this. By giving up regular stimulation, he wasn't just losing intimacy. He was losing circulation, muscle tone, and nerve connection. This isn't about chasing youth. It's about keeping your foundation strong. Ignoring your pelvic floor leads to more than discomfort. It leads to loss of freedom, independence, and dignity. But here's the good news. You can reverse the trend. You can re-engage those muscles. And it doesn't require a gym, medication, or surgery. Sometimes it starts with something as simple and as natural as reconnecting with your body. Your pelvic floor is still listening. Don't let it go silent. 6. Reduced resistance. You used to bounce back from a cold in 2 days. Now, one sniffle turns into 2 weeks in bed. You feel drained more often. You get sick more easily and stay sick longer. Think it's just getting older? Maybe not. What if your immune system is struggling because you stopped doing this one thing? Let's cut to the truth. Your immune system isn't just powered by vitamins and sleep. It's influenced by your hormones, your stress levels, and yes, your sexual activity. During sexual arousal and climax, your body releases a surge of powerful biochemicals that do more than feel good. They help fight infection, they reduce inflammation, and they send your immune system a clear message: stay alert, stay strong. One of those powerful agents is called immunoglobulin A, or IgA. This antibody is your body's first line of defense against bacteria and viruses, especially in your respiratory and digestive systems.
And here's what's wild. Research shows that after orgasm, levels of IgA go up, sometimes significantly. Endorphins are also released, lowering inflammation and speeding up recovery. Now imagine going without that boost for months, even years. You're not just missing out on pleasure, you're denying your body one of its most natural defenses. I had a patient in his late 60s, fit, active, retired, but he kept coming in with minor infections that wouldn't go away. He told me, "I used to shake this stuff off in no time, now I'm knocked out for weeks." We ruled out diet, sleep, medications. And then I asked, "When was the last time you were sexually active, even by yourself?" He paused, looked away, and said, "Not in years." That answer said everything. He didn't know that sexual inactivity had left his immune system running on low battery. You don't need to be young to stay healthy. You don't need to rely on pills or expensive supplements. Sometimes your body is already equipped with what it needs. It just needs a reason to activate. Regular self-pleasure isn't just for emotional wellness or hormonal balance. It's a biological signal that says, "I'm still here. I still care. Keep fighting." Don't underestimate the quiet power of stimulation. It might be the immune boost your body's been waiting for. 7. Disconnection from body, decreased self-esteem. You look in the mirror and feel like a stranger. You used to stand tall. Now your shoulders slump. You used to feel alive in your skin. Now it just feels numb. This isn't just about aging. This is about something deeper. You're not just losing strength, you're losing your sense of self. Here's a truth most people are too afraid to say out loud. The moment you stop touching your body is often the moment you start disconnecting from it. It happens slowly, quietly. You stop noticing your reflection. You stop taking care of how you move, how you feel, how you show up. You start going through the motions of living without really feeling present. But why? Because the physical relationship you had with yourself, the one that kept you grounded, alert, and connected, has gone silent. Masturbation isn't just physical, it's personal. It's the moment you tell your body, "You still matter, I'm still here." It keeps your nervous system active, your hormones balanced, your identity engaged. When you stop stimulating your body, it's not just sensation that fades. It's confidence, it's self-image. It's the reminder that this body is yours, to care for, to enjoy, to live in. Without that connection, it becomes easy to give up on your appearance, on your energy, on your worth. I've spoken to patients in their 70s and 80s, once proud, once vibrant, who now say, "I don't feel like I live in this body anymore." They stop dressing with intention. They stop making eye contact. They stop believing they're still worthy of affection, even from themselves. And the saddest part? They think it's normal, that this is what it means to get old. But it's not. That feeling of fading away isn't aging, it's abandonment. Abandonment of the self. And the good news is, it's reversible. When you reconnect with your body, when you touch yourself, not out of shame or habit, but with care, you take back more than sensation. You take back ownership. You take back presence. You take back you. So if this message spoke to you, don't keep it to yourself. Hit that subscribe button to stay informed about how to care for your body as you age. Share this video with someone who may be silently struggling. And comment below, have you ever felt disconnected from your own body? What does feeling like yourself again mean to you? Ask your questions, tell your story, because someone out there is waiting to hear they're not alone.